HAZWOPER. Chapter 8. The importance to dosage. Presented by Active Environmental Training. Remember that you can contact Active Environmental Training at any time if you feel you have any comments or concerns related to this, or any other environmental or safety topic. Contact Active Environmental Training at 407-860-0369. Or visit us in internet at www.activet.com. Remember that your comments or concerns are always welcome. Let's begin with our presentation. Terminal learning objectives. By the end of this section, you should be able to define dosage, comprehend fundamental toxicological terminology, identify potential doses encountered by HAZWOPER workers, recognize standard units of measurement for dosage, explain factors influencing toxicology, understand the relationship between dose and response, describe the impact of doses on individuals. Introduction. Now that you possess a foundational understanding of toxicology, we aim to broaden your comprehension by delving into the concept of dosage. It's imperative for every HAZWOPER worker to grasp dosage principles, as daily work decisions often hinge upon dosage and exposure levels. Let's commence by elucidating the concept of a dose on the subsequent slide. What constitutes a dose? A dose denotes the quantity of a substance administered at a given instance. However, additional parameters are essential for characterizing exposure to xenobiotics, notably the number of doses, frequency, and total duration of usage. For instance, an individual might consume 650 milligrams of Tylenol as a single dose, 500 milligrams of penicillin every 8 hours for 10 days, 10 milligrams of DDT daily for 90 days. Are all agents toxic? As articulated by Paracelsus nearly 500 years ago, all substances are poisons, there is none which is not a poison. The right dose differentiates a poison and a remedy. Hence, even seemingly innocuous chemicals like water and oxygen can induce toxicity if ingested, imbibed, or absorbed excessively. Types of doses. Apart from various means of expressing dose, different types of doses exist. For example, exposure dose. The amount of xenobiotic encountered in the environment. Absorbed dose. The portion of the exposed dose that enters the body. Administered dose. The quantity administered, typically orally or via injection. Total dose. The cumulative sum of individual doses. Fractionation. Dividing a total dose into smaller fractions dispersed over time typically diminishes the likelihood of toxicity. This strategy capitalizes on the body's capacity to mitigate the effects of subtoxic doses given sufficient interlude between administrations. Consequently, a dose that would prove harmful if administered all at once may pose minimal risk when dispensed gradually over time. Measurement units. Toxicological units mirror those used in medicine, with the gram serving as the standard unit. However, since most exposures entail minute quantities, the milligram is commonly employed. For instance, the typical adult dose of Tylenol amounts to 650 milligrams or 0.65 grams. Toxicological factors. The clinical and toxic repercussions of a dose correlate with age and body size. Adjustments are necessary considering the varying susceptibilities among demographics. For instance, while 650 milligrams constitutes an adult dose of Tylenol, such a quantity could prove toxic for young children, hence the formulation of children's Tylenol tablets at just 80 milligrams. More measurement units. Given the toxicity of certain xenobiotics even in minuscule amounts, smaller fractions of the gram, such as micrograms, μg, are utilized. This granularity permits precise quantification and evaluation of substances, especially those with potent effects at low concentrations. Environmental exposure units. Environmental exposure units denote the quantity of a xenobiotic present in a unit of the medium. These units vary based on the medium involved, encompassing milligram/liter for liquids, milligram/gram for solids, and milligram/cubic meter for air. Dose-response relationship. The dose-response relationship constitutes a pivotal tenet in toxicology, elucidating the causal nexus between exposure and effect. Generally, heightened doses elicit more pronounced responses, with the relationship delineated through empirical data derived from experimental studies. Response to the same dose. While the bulk of responses to a toxicant are akin within a population, a spectrum of reactions may manifest due to individual variabilities. This variance is often depicted graphically via a bell-shaped standard distribution curve. The threshold dose level. Dose-response curves typically adopt an S-shaped sigmoid form, wherein small doses are typically non-toxic. The threshold dose level denotes the point at which toxicity commences, with the curve ascending steeply with escalating dose levels. The dose-response curve. Understanding the shape and slope of the dose-response curve is instrumental in predicting substance toxicity at specific doses. Variations among toxicants may encompass disparities in threshold attainment and the magnitude of response per unit dose change. Lethal dose 50. Dose-response curves facilitate the derivation of dose estimates, with the lethal dose 50% (LD50) serving as a common metric for acute toxicity. This statistical measure denotes the dose wherein 50% of the subjects are anticipated to succumb. Concentration versus dose exposure. For inhalation toxicity assessments, air concentrations serve as the principal exposure metric. The LC50, or lethal concentration 50%, denotes the lethal gas concentration for 50% of the exposed group. Effective doses. Effective doses, EDs, signify the potency of a substance in producing desired effects, whether beneficial or deleterious. Contextual specificity is imperative in elucidating the specific endpoint under consideration. Toxic doses. Toxic doses, TDs, denote doses that yield adverse effects. Various dose estimates cater to different response thresholds, enabling nuanced risk assessments. Comparing results. Comparative analyses of effective and toxic dose levels aid in gauging substance safety and efficacy, crucial for pharmaceutical development and risk mitigation. NOAL and LOAL. Notable indices in dose response assessments include the No Observed Adverse Effect Level (NOAEL) and Low Observed Adverse Effect Level (LOAEL), gleaned from empirical studies to inform risk evaluations. NOAEL refers to highest data point at which there is no observed toxic or adverse effect. LOAL refers to lowest data point at which there is no observed toxic or adverse effect. Summary. In essence, the toxicity of a substance hinges upon its dosage, with individual characteristics modulating susceptibility. Metrics like LD and ED delineate the dose thresholds for adverse effects or efficacy, pivotal for pharmaceutical advancements and risk management.